All right, thank you so much. Welcome to today's webinar on the Indiana Human Services Legislative Wrap-Up session. This is Lucinda Nord with Indiana Association of United Ways, and I am joined by Mark St. John, who is a lobbyist and principal with St. John and Associates and represents Indiana Association of Community Economic Development, and is also my co-chair with the Indiana Coalition for Human Services. So today we're going to offer this, we're very pleased to bring you this webinar in partnership with the Indiana Nonprofit Resource Network and the Indiana Association of United Ways. If you have not done so already, I'm going to highlight very quickly that you may download the slides in two different versions and a handout at www.inrn.org. So feel free to download those slides to follow along if you are the note-taking type. So we will go ahead and begin this session. Our goal is to fly through the content, not actually covering everything on the slides, but reserving plenty of time for question and answer. So without further ado, let's begin. So these are our contact information, and you'll see that again later. So just as a quick reminder, well, let's first start at the federal level, because there's lots of discussions going on at the federal level right now around tax reform. In fact, a new report was just released this morning about tax reform. And now that we've passed that, the first implementation of the sequestration, we are actually starting to see some budget negotiations going on for this next fiscal year. The sequestration effects are starting, although there were a lot of federal agencies that actually held back dollars in anticipation. So we're not feeling it in the same way yet in Indiana, but there is a website there if you'd like to go and see some of the possible effects that might be coming. In terms of tax reform, as I mentioned, there's a new report that was just issued with regard to all the recommendations that are coming, that are under review right now at the federal level. The things that are really important to the human service community in Indiana are things like the charitable deduction and how that will be preserved, earned income tax credit and the child tax credit. There are some recommendations around those, as well as some other important tax credits to most working Hoosiers, such as the mortgage interest deduction. So let's actually talk about why you're all here today, and that's to give you an update of what's happening in the State House. But before we do that, let's just see who is on the phone with us, who's in this call today. If you could respond to this quick poll. What is your primary role? Are you considered executive staff or policy staff or blended? Looks like we have about half of the attendees today are executive level staff, and about a third have both some administrative management functions as well as client work. So thanks for participating in that poll. We have a number of direct service workers as well. So thanks so much. Oops, sorry about that. I just lost our session. There we go. Hit the wrong button. And let's show everybody what that looks like. You can see. There we go. All right. So you can see who's on the phone with you today. Let's actually move right back into what's happening in our State House. And this was our long session. The odd years are budget years. We create our $30 billion budget. As we've talked about on prior webinars, there are supermajorities in both chambers, and a remarkable number of legislators have less than 2 years experience. When we started out the session, we expected that these would be the hot issues, jobs, the budget, healthcare, education, a lot of the Department of Child Services attention, and then some other social issues. And let's actually find out what happened in each of those areas, and that's the purpose of this webinar today. So at this point, I'm going to let Mark talk a little bit about the biennial budget.
Thank you. The budget passed in the last few minutes of the session, like it always happens. We ended up with a 5% income tax reduction that was phased in over 2 years. And there was, but they also reduced taxes for financial institutions. They also did stuff on inheritance tax and some work on casinos. So they reduced state revenue. At the same time, they did fully fund the Medicaid forecast for this next year, which is not the Medicaid expansion. This is just the forecast of what Medicaid as it is right now will continue to pay for. And then a lot of money that went into roads and bridges and infrastructures, a big emphasis on that because of jobs. So when you look at the next slide about biannual budget by ICHS priorities, there were dollars there for adult education, Working Hoosier stuff, individual development accounts, a real emphasis on having a workforce-ready graduates. There was a 3% increase in K through 12 education over the next 2 years, but that does not offset the cuts that had happened in past years. They did set aside some additional money for the implementation of the Affordable Care Act, and then a strong emphasis about additional monies for the Department of Child Services. The next slide talks a bit about final budget, stuff that it did not include. They came up with these new regional work councils to help improve employment opportunities, but they didn't fund it. There was, even the budget did not include Medicaid expansion, but did give the governor the ability to negotiate with the feds for a Medicaid expansion in the future. There was funding for 211 call centers, but that did not happen. And there was no investment into juvenile detention facilities. And a big one is that they did all this work on the criminal code reforms and trying to have more community sentencing alternatives, but they didn't put any money into those alternatives. Linda, why don't you, or Linda, Lucinda.
I will take it from here. Great.
Yeah.
So in the early care and education area, there were a number of incredible improvements that happened. And sorry about the slide change there. So there were big, broad attention to early care and education this year. So comprehensive criminal background checks for child care workers. We know that that will create some rumbles in some communities because folks will actually have to be fingerprinted to work in a child care home, center, or ministry. There are new requirements for child care providers that accept the taxpayer-subsidized Child Care Development Fund. There was a great debate about pre-K and whether or not the state should invest in that. So the compromise position at the end was that there would be a pre-K matching grant program of only $2 million a year, and that's for the highest quality programs. We detail a lot of that information in our newsletter, and we have some additional information for you. Full-day kindergarten funding was in the school fund formula, which is a victory for early education advocates, and then the Paths to Quality program, which is that voluntary rating system for child care, was also codified. With regard to education at the K-12 and higher education level, there was sort of a mixed feeling about education reform. On the one hand, there was this sense of sort of education reform fatigue, and then on the other hand, there was this move to let's just steamroll ahead and continue with education reform. So you can see there's lots of changes coming with regard to expansion of the school scholarship or voucher program. Common Core was hotly debated, and that was actually paused at where it currently is and will be studied. There are new definitions coming around absenteeism, truancy, excused and unexcused absences, every effort to try to make kids stay on track to graduate on time, reward those schools that are able to do that, and reward those teachers who are able to do that, and to loosen some of the requirements. So, for example, superintendents no longer have to have an educational background. Teacher education programs at the colleges are going to be evaluated. And then lastly, there's also some attention at the higher education level, trying to ensure that students who graduate high school are actually ready for college and are ready to receive the financial aid and to receive the education, and then some connection to funding of higher education connected with that, both at the student level and the institution level. In terms of other education matters, I know a number of our partners around the state were very interested in a couple of these key bills, particularly the school resource officers. Those are the actual law enforcement personnel who are operating in K-12 schools for security purposes, but they also have additional training. So there's a lot of, there's a grant program that will help put more school resource officers or other safety measures like cameras and detection equipment in schools. The anti-bullying bill was a big victory after many attempts to have schools develop policies around anti-bullying and putting some preventive measures. There's some other issues around gangs and school-friendly policies and bus safety. As you can see at the top there, you see that there was a lot of attention on resident tuition for certain students. This is the children who are often called the dreamer children, who were brought here illegally. There were about 200 college students enrolled at the time that the bill passed a couple of years ago, and this simply allows those 200 kids to finish their school at in-state tuition rates. So there were a lot of changes in health, and Mark, you want to talk about health?
Very quickly here. After a lot of discussion, the state legislature did the things that they needed to do for Indiana to implement the Affordable Care Act and the health benefit exchange stuff in House Bill 1328. But the whole issue about Medicaid expansion has been left to the governor to negotiate with federal centers for Medicaid and Medicaid services. Choice funding was maintained and put some limits on how much of that monies could be used for Medicaid match. Some additional stuff about electronic cigarettes, about patients with physical therapy, seeking physical therapy without a physician referral. But the big issues were around the Affordable Care Act. When you look at the next slide about financial stability.
Hold on, Mark. We actually added a slide there around seniors and people with disabilities. So Mark already talked a little bit about the choice funding and some of those attention around, say, Alzheimer's and detention and the post orders. But there were also some great victories for people with disabilities this year. There was a bill that was somewhat high profile around the use of restraints and seclusion in schools, and now there are going to be appropriate policies developed around that. For the first time in over a decade, full funding for Voc Rehab was put into the budget, and which is just a wonderful way that it puts people with disabilities back into jobs. Adult guardianship was protected, and there's new other training program, which leads us right into the financial stability area.
One of the most important things, I think, and it sounds simple, but they're going to transition SNAP benefits, Special Needs Assistance Program, the food stamps. It's going to transition from being from the first 5 days of the month through the 5th through the 23rd of the month. This should help grocery stores be better stocked, and it should help food pantries. It should do a variety of things. It will be edged into. It won't happen all at once. There's also some concerns about potential fraud with the electronic benefit transfer cards, and so there'll be Senate Bill 559 looks at some of those issues. The funding for the individual development accounts, that sheltered savings, was maintained at $1 million a year. Two other things big was this whole thing about the criminal code reform in House Bill 1006. It also, that combined with a real expungement bill to be able to, under certain kinds of non-violent acts, can move those with the right kind of approval, can move those convictions off of their record and help them in terms of becoming employed. And then the whole issue around drug testing for TANF beneficiaries died at the very end of the session, but expected to come back next year. Lucinda, why don't you move on to child services then?
Okay. And also in the area of financial stability, a big disappointment is that whole area of transit, which failed, but will be studied again, and we'll talk about the study committees a little later. A major effort, as we've talked about on prior webinars with the study committee on the Department of Child Services all last summer, came out of that study committee were a number of recommendations about how to improve the hotline, how to ensure that the DCS hotline for reporting abuse and neglect ends up being more about risk assessment rather than screening out, so that the mandatory reporters and those with good authority to know, like judges and counselors and school personnel, actually have a direct line to those county offices. So we saw a number of those reforms were actually included in freestanding bills as well as incorporated into the budget bill. We know that a lot of the partners on this call were very concerned about the CHIN 6 designation, which allows behavioral health care for children not eligible for Medicaid. Those are the parents who were returning themselves in for abuse or neglect, even though they weren't abusing or neglecting their kids, but they just needed the services, and that was the only way that they could do that. So we see a lot of changes in DCS with the child fatality reviews, a new commission on children. There were some other changes in the laws around definition of hazing and the statute of limitations on child abuse and child seduction. So we're seeing a number of changes that I think are welcome by the child advocacy community. In the strong communities area, Mark, do you want to talk a little bit about that?
Several of you are probably aware of or benefit from the Neighborhood Assistance Program, the tax credits that provide a 50% tax credit when someone gives a certain kinds of charitable donations. That was not touched, even though it was discussed during this last summer. It did not change. There was also a renewal of a foreclosure filing fee that happens that the banks pay when they file for foreclosure. The monies from that help pay for foreclosure counseling to help keep people into their in their homes, and that was maintained too. There was also several different bills that called for issues around looking at abandoned properties, and there is a study committee that's looking at land banks this coming summer. And then one other issue around lobbying registration fees. Some of the nonprofits that are on the phone have not had to, some have been registered as lobbyists, some have not, and but this bill doubled the fee from $50 to $100 to be a registered lobbying as a nonprofit, but clarified that those fees are not part of the lobbying expense calculations. So it shouldn't really change who has to register in the future to do lobbying at the State House. Lucinda, can you talk about elections a little bit? Then?
I sure can. There were a number of bills that tried to look at the issue of good government. When you think about the lobbying bill and you think about elections, there were a number of bills that tried to address that. Some of the bills are still sort of being interpreted. Many of them were negotiated in the final hours. But some of the provisions include things like how to handle voter registration applications that are incomplete. You know, there's been a lot of scrutiny and thought that there's this rampant voter fraud going on. So there were a lot of efforts to look at how to address those. How do you handle electronic poll books? How do you mark the cutoff in the line on a primary day if you're in the line on a primary day or at an early voting location? If you're in the chute at the closing time, can you still vote? And those kind of things were clarified in a number of bills. There was a bill around college students. That bill was actually dropped. But there were a number of bills around election procedure. So we also wanted to talk a little bit about what didn't happen and where is Indiana with regard to the Affordable Care Act implementation, because we get this question a lot. So let me start with the ACA. And that is that because we know it's very complicated, many of you are experts on this call, but some of you may be just sort of following along tangentially through the news. Our state had a number of choices to make in terms of how we would implement the Affordable Care Act. So one of the decisions we had to make was to, as Mark mentioned earlier, the state is going to still retain some oversight over who provides insurance, how the insurance is provided, and that was in some of the legislation. The state also has to approve what is going to be the essential health benefits package that is offered on the health insurance exchange. And basically that's going to be your essential basic anthem plan. Then the state had to make a decision, and this was made actually under Governor Daniels and then the transition to Governor Pence, that Indiana is going to participate in the federally facilitated exchange marketplace. We're not creating our own exchange. So what that means is that of the 880,000 uninsured Hoosiers, about half of them are above 100% of poverty. So those who are above 100% but below 400% can purchase, beginning this fall is the enrollment period, they'll be able to purchase health insurance on the federally facilitated exchange, and there will be a lot of marketing about that. The big unknown right now is what happens with those who are below 100% of poverty but above the eligibility to qualify for traditional Medicaid. And that is what we're waiting on. This is the big waiting game, and that the state of Indiana has applied to the federal government, to the Center for Medicaid and Medicare Services, for an extension of the Medicaid waiver that we have currently that allows us to operate the Healthy Indiana Plan. Basically, we have, as a state, proposed that the Healthy Indiana Plan be used as that expansion vehicle for everyone who's above the traditional eligibility for Medicaid to 100% of poverty. So what does that mean? Right now we're waiting for CMS to make a decision. If we are denied, if the state is denied on our application or proposal, what that means is that about 400 to 450,000 people will not have access to anything. If it's approved, either as it was proposed or in some sort of amended version, which is kind of what most people are expecting, those folks who are above traditional eligibility for Medicaid but below 100% of poverty will be able to pay in basically on a sliding scale, into the Healthy Indiana Plan. If that proposal is denied, the current HIP program will actually be dismantled by the end of the year, which means that about 39,000 Hoosiers who are currently on the HIP program won't have access. Right now, CMS is accepting comments on that proposal. We have a lot of information about it through the Cover Indiana. We don't, but coverindiana.org has information about that, as well as we put it in our newsletter. So if you'd like to file comments about the Healthy Indiana Plan, we'd certainly be able to tell you how to do that. So let's talk a little bit about what did not happen. And Mark, you want to talk a little bit about that?
There were lots of other things that didn't happen. One was the so-called ag-gag bill that would have prohibited photos or videos of certain facilities and farms and stuff. That bill died at the very, very, very end of the last day that they were in here. It became quite controversial. This proposal about cursive writing came up again. It passed the Senate a second year in a row, but the House didn't do anything with it. The same issue was lost was the mandatory reporting of domestic violence in hospitals. Mandatory kindergarten didn't happen. There were some proposals that would have done some anti-immigrant activities, and those didn't happen. Firearm legislation didn't happen. At one point, the school resource officers bill had in the ability for school corporations to have an armed employee at all their schools, and that went away. The gay marriage amendment to the state constitution, it didn't come up this year. It will most likely come up next year as the legislature faces a deadline if they want to put that before the voters. As I mentioned earlier, drug testing for welfare benefits died at the very last minute. This proposal about Sunday liquor sales in Indiana, apparently Indiana is the last state in the nation that does not allow liquor sales on Sunday, but that died. And there was a last-minute proposal about lowering the income threshold for eligibility for pregnancy for Medicaid, and that was successfully pushed back. I'm sure there were other things, but those were some of the highlights of things that didn't happen. Lucinda.
Yes, and so what commonly happens during the legislative process is that if a bill gets a lot of attention but there's just not a good compromise, it results in something being sent to study committee. And a quick review of those resolutions and the budget bill and the bills that ended up in a study committee or had language either requesting a study or suggesting a study or asking for a required study, there were more than about 60 topics. And the process for that is that the Legislative Council will get together later this month, actually next week, or I'm sorry, in 2 weeks, and decide which of those topics actually get studied. So you can see here just a partial list of some of the things that we anticipate will be studied. Those that you saw a lot of attention in the media will probably get some good attention over the summer, like the issue of school discipline and safety. Transit, of course, will be studied again. There was a lot of attention around the eligibility benefits related to EBT cards and SNAP. There's new attention around telehealth and telemedicine under Medicaid and what that looks like. So this is just a partial list. As soon as the Leg Council meets and they promote their list, we will publicize that. So what we wanted to do in the next couple slides very quickly is just remind you that we have a guide to safety net programs that offers just quick descriptions about TANF and SNAP and unemployment if you're not sure. And then to remind you that nonprofits may advocate even though the legislative session is over. Now is actually the right time to start making connections with your legislators. We encourage you to work with your boards to start talking about advocacy, learn a little bit about it. Again, Mark mentioned the lobbying law earlier. There are rules around who can lobby with what kinds of funds and what that means. Lobbying is simply trying to shape or influence the outcome of a policy decision or a funding decision. So there are specific rules to follow, but nonprofit 501c3s may lobby, and we wanted to be clear about that. What you can be doing between now and the fall is, first of all, identify the things that you liked. Let's help reinforce good behavior and thank the legislators. We had a number of legislators who crossed over and for bipartisan efforts, or who took really courageous positions on certain issues, and we want to thank them for their leadership, for their efforts to understand issues. So make sure you write down a note when you see them at the store or at a restaurant or at your 4-H fair this summer. Make sure you thank them for their work. There's still the opportunity to attend some wrap-up sessions. A number of the legislators actually have town hall meetings where they talk about what happened. You could hold a board meeting where you talk about maybe some of the highlights from this webinar of some of the bills that affect your clients. So we encourage you to not use the summer as a vacation from advocacy, but this is a different period of your advocacy efforts. How we like to work with you from both an Indiana United Way perspective and an Indiana Coalition for Human Services perspective is really engaging in two-way communication. What we'd like to start doing is thinking about what kind of testimony will we need for those summer study committees. If we know that a particular issue is going to be studied, for example, the concussions in youth athletics, we know that a lot of after-school programs or youth athletic programs through Boys and Girls Clubs or YMCAs are interested in that issue. So maybe gathering some information could help. There are a number of coalitions. You see a quick list here that we encourage you to get involved with. A number of those coalitions hold information sessions over the summer or the fall as they gear up for the next year. This is the list of some of those websites of those coalitions, and we encourage you to visit them, maybe even join some of those coalitions or sign up for their newsletter lists. Here are some other helpful websites at the federal level or more interest, if you have more interest in the issue of nonprofit advocacy or lobbying. And then lastly, we want to thank you for all your support and need. But before we do that, we want to give you an opportunity for question and answers. We intentionally flew through the slides very quickly and the content. What we ask you to do is to use your question box, and if you could ask your question, we'll repeat the question and go back to specific parts of the presentation, or if we don't know the answer, we will do the research. So feel free to use your question box now. And
for those of you that have been on these calls previously, also understand we moved along quickly because Lucinda threatened my very life if I didn't.
No, that's not true. We did want to make sure that we had lots of time for question and answer. So, are there any questions? I don't see any questions coming through yet. Okay, so we have a question about, oh my gosh, we have lots of questions coming in. So let me start with the first one. It's a budget question. So I'll read the question. It's from Mark down in Columbus. Hi, Mark. How are you? What is the projection for the budget surplus going forward? And did the recently announced refund actually happen? So do you want to take that, or should I, Mark?
The budget, well, I'm not sure about what the projected surplus is. We'll need to go back and look at that, but we can do that. What they did do was keep part of the refund stuff, but they also delayed some of that here to the future. They've horsed with that. I think we're going to probably have to get you. We will put that in the in the follow-up stuff.
In the frequently asked questions. Yes, I think I just saw a
Frequently
news story the other day that the projected revenue forecast, our actual revenues for April, came in stronger than what the forecast projected. So there are a number of different numbers in this game of creating the budget. So budget writers look to a budget forecast, which is done. And then the actual budget includes a provision that says if our surplus gets more than a certain percent, and it used to be 10%, and I think what we need to confirm is I think it may be 12% now, then taxpayers will be issued an automatic refund. And there was a lot of discussion about should it all be in refund or should it be going to pay down some of the other debt that we might have and unfunded liabilities like retirements. So those are the kinds of things that we'll get the actual detail for you. Our next question comes from Kelly, and it says, I want to better understand the state's discussion about immunizations. So I can take that question. There are a couple different things going on with regard to immunizations. One, there will be a study committee, I believe, this summer about adult and child immunizations. So if that's an interest of you, that's something you'll want to follow. With regard to immunizations, the bill that passed came from Representative Davison from Southern Indiana, who is a pharmacist. And the bill actually, it's a pretty good bill. What it does is it allows pharmacists and pharmacy students to offer the immunizations through pharmacies. So there are certain kinds of immunizations that before you had to go through a doctor's office or to get a prescription to do, and now you can actually get them at your local pharmacy. And from a pandemic kind of preparation perspective, this is something that's really being encouraged by the CDC so that immunizations become much more accessible to the general public and convenient so that people can go and make sure that they are immunized. There's a specific list, though, of what types of immunizations are allowed under that. So I hope I answered that question around immunizations. We have a question from Ray asking, and Mark, maybe you can help on this one. Do you expect any kind of study committee regarding the ag-gag rule, since you said it was controversial?
I do not. Now that doesn't mean it won't happen here. It's not anticipated. What we don't have a good feel is for the proponents how strongly are they pushing on it. It could happen in the interim committee that looks at agricultural issues. There are other committees that could come up with, but at this point it's not listed and not anticipated.
Right. That particular bill, the ag-gag, I hate to even use that term, but it really sort of took two different perspectives. One was really an issue that's being debated in a number of circles around the issue of privacy, and that is our laws haven't really kept up with the way that technology addresses issues of privacy in terms of everyone's carrying around these smartphones that actually have locators on them and have all kinds of equipment that can take photos and recordings, and how do we handle that? But then there's the other issue of sort of the First Amendment rights and free speech rights and the issue of the press having access to be able to uncover things that are inappropriate going on in the public or in private industry. So whether or not that will be studied, I'm not really sure, but it's multi-layered problem.
There is a possibility that the idea of drones might be looked at this summer, and that could move into a broader study. That's a possibility.
Very true. Okay, we have another question, and that comes from Ray and a couple others, actually. Can we get a copy of these slides? The slides are actually posted at www.inrn.org. You can go to the website. In fact, we actually published another document this morning that might be a little bit easier for you to read. And forgive me while I try to pull it up. My computer's not cooperating, but if you go to www.inrn, there should be a PDF document of a quick list of all of these bills summarized in very tiny font, but it's just a quick 2-pager. So we encourage you to download that. I'm not seeing any other questions. I'll ask one more time if we have any more questions. And as always, Mark and I offer that if you have questions, we certainly welcome you to forward those to us personally, and we'll try to get those back. We do have another question from Kelly, and that's, if Indiana's HIP plan is denied by the feds, what will be the safety net for the $450,000 that don't fall within that below the 100% of poverty? So if the HIP plan is denied, where those folks go today, which would be the low-cost health clinics or the emergency rooms at the hospitals, will probably be where they will continue to go. As I mentioned before, most of the advocates believe that there will be some sort of negotiation between the state and the feds to allow some sort of version of the Healthy Indiana Plan. On the one hand, you have folks who really, the features that they like about the HIP plan or the Healthy Indiana Plan are that it covers preventative care. It really incentivizes good consumer choices in terms of shopping for health care and consumer behavior in terms of taking care of yourself. It also has that power account, that element of personal responsibility, and advocates for HIP really like those features. The challenges to it currently are that there are some features in the current plan that kind of run contrary to ACA according to the critics, and that would be things like annual caps, lifetime caps, what kind of coverage is allowed, how it handles pregnancy, and we anticipate there might be some negotiation on that both ways. So the quick answer to your question is, if it's denied, if the plan is denied, then those people will be in a gap and they won't have access, and they'll use the traditional, what they use today, which would be a low-income clinic, paying out of pocket themselves, running the risk of bankruptcy, or going to the emergency rooms. And what's hard about that is that the DSH payments, the disproportionate share payments that go to hospitals to cover indigent care right now, are being reduced as a part of the Affordable Care Act. So that's a very long-winded explanation. I apologize for the length of that. Any other questions? I don't see any more. I'll give it just another minute. All right. I'm not seeing any other questions coming in. So again, on behalf of, I'll start doing a wrap-up. On behalf of our coalition, the Indiana Coalition for Human Services, we invite you to join ICHS if you are a human service provider. We are looking at possibly coming out in local communities again and doing a sort of wrap-up or bringing some materials to you if you have a number of providers in your community who would like a conversation. We also have our annual meeting in August and want to invite you all to come to Indianapolis for that annual meeting. We'll be announcing that shortly. On behalf of Indiana Association of United Ways and the Indiana Nonprofit Resource Network, we thank Mark St. John for joining us today, and we thank all of you for taking time out of your day to learn a little bit about how the new laws are going to affect your organization, your clients, and your neighbors. So thank you all so much. At the conclusion of this webinar, you will have the opportunity to complete a survey. We ask you to complete that survey if you could, and invite you to send us any comments or questions afterwards. Thanks so much.
Thank you.